Wonderful. All right, welcome everyone to our closing session, Working Together to Save Lives. Thank you for attending the State of the Black Breast Cancer Crisis, a national virtual town hall and call to action. And remember, please submit questions to our panelists in the Q&A box at the bottom of your screen. One moment, all right. Again, I am Athena Jones from CNN. I've enjoyed being your moderator for this historic event. As I mentioned earlier, when Sisters Networking asked me to be involved with this national town hall, I immediately said yes, because this discussion is important to me personally. As I mentioned before, I'm a two-time breast cancer survivor, having been diagnosed by chance at age 36, and then again at age 39. We hope you've enjoyed hearing from some of the nation's leading medical experts in the breast cancer field. This morning, we've discussed the state of Black breast cancer and heard from our medical experts about early detection, triple negative breast cancer, genetic testing, and the importance of participating in clinical trials for Black women. Our last session is about working together to save more Black women's lives. In a few minutes, you'll hear from our esteemed panel. But before I introduce our panel, I want to thank Sisters Network for having the courage to sound the alarm and say that we have a Black breast cancer crisis here in the United States. And it is unacceptable and something must be done. Most importantly, thank you, Sisters Network Incorporated, for having the vision to host this collective discussion and call to action. Now I'd like to introduce our panel. Each of our speakers is going to briefly share their thoughts on the work they're doing in regard to breast cancer and breast health, and talk about how we can work together. Now, we've heard from three of our panelists in the opening session, so I'll give a brief introduction of them and then a fuller introduction of the remaining panelists. So Karen Eubanks-Jackson, the founder and CEO of Sisters Network, Inc., is a 28-year and four-time breast cancer survivor. Dr. Edith P. Mitchell is clinical professor in the Department of Medicine and Medical Oncology at Sidney Kimmel at Thomas Jefferson University, and is also a retired brigadier general, the first woman physician ever promoted to that rank in the Air Force. Dr. Lisa Newman is a surgical oncologist with a practice dedicated to breast cancer management and oversees the breast program for the Weill Cornell Medicine New York Presbyterian Hospital Network, serving its Manhattan, Queens, and Brooklyn sites. We also have joining the panel Dr. Kimberly Jeffries Leonard, PhD. She's the 17th national president of the Links Incorporated and the Links Foundation Incorporated, one of the nation's oldest and largest volunteer service organizations of extraordinary women who are committed to enriching, sustaining, and ensuring the culture and economic survival of African Americans and other persons of African ancestry. Dr. Jeffries Leonard has a lifelong commitment to public service, exemplified throughout her successful professional, academic, and civic endeavors. She has over 35 years of applied health, minority health, and behavioral medicine research, evaluation, technical assistance, and training experience, specializing in health promotion and disease prevention. Dr. Jeffries Leonard is also the president and CEO of Envision Consulting, a boutique public health consulting firm specializing in strategic and innovative executive level solutions for public, private, and government entities, including strategic planning, program design and implementation, programs and systems assessment and evaluation, and minority community engagement. Dr. Jeffries Leonard's curriculum vitae reflects her tireless efforts throughout her career to promote education and improve services for those facing health challenges due to disparities in education, access to care, and other socioeconomic factors. We also have Dr. Aronica V. Williams. She is here representing Rashida S. Liberty, the International Grand Bacillus of the Sigma Gamma Rho sorority, who was unable to attend at the last minute. Dr. Aronica Williams leads Sigma Gamma Rho Sorority Incorporated's medical task force. Since its inception in 1922, the dynamic women of Sigma Gamma Rho have built and sustained a well-known and well-respected reputation for leading positive change to help uplift the community through sisterhood, leadership, and service. Sigma Gamma Rho's commitment to service is expressed in its slogan, greater service, greater progress. The sorority has a proud history of providing positive and proactive community outreach nationally and internationally. The programs, partnerships, and sponsorships represent Sigma Gamma Rho's commitment to promoting the greater good in education, service, and leadership development. Dr. Williams serves as the Chief Medical Officer at Milwaukee Health Services Incorporated, a community health center that provides accessible, quality, primary and related healthcare services to Milwaukee residents, with the continuing emphasis on medically underserved families and individuals. So first, we're going to hear from Karen Jackson, who is going to discuss the new initiative that is part of today's call to action. Karen Jackson.
Good morning again, and thank you, Athena. Sisters Network, we all know, has worked tirelessly to educate our community and support and increase awareness. But health disparities is real. And the current Black breast cancer statistics clearly support this movement. There is a problem and crises for Black women. As we move forward, we have a new task force logo and shows that Sisters plan to take action by launching this new logo. It's the National Black Health, Equity, Policy and Community Action Task Force. You are the collective power to establish this task force. We are adding an open invite to join the task force, along with many other strategic partners, community leaders, and health advocates. Your input will help determine the task force success. Some of our goals will include to join the forces with Sisters Network to identify and address the Black breast cancer health inequities, systematic injustices, and develop strategic and eliminate barriers. I want to just mention a few others, but this is only the beginning, so your input is going to be very vital. Second goal is to advocate to lower mammography screening guidelines and add ultrasound to baseline screenings. There's a lot of controversy. This is just an opening suggestion. We know it's needed, but we have to fight together to make things happen. Third, identify effective outreach to amplify breast health awareness screenings and clinical trials, so Black women can open up and get participation. But first, they have the knowledge that their participation is needed. Fourth, build a sustainable breast cancer community task force action network, which includes the strength, power, and change. These are exciting times for everyone. We'll be reaching out to you in the coming weeks to get involved to discuss the next steps. So I turn it back to you, and I'm anxious to hear the conversation myself. Thank you.
Thank you, Mrs. Jackson. I look forward to this conversation as well. And I've introduced the panelists. I'd like to ask each of you to talk with our viewers to briefly talk about your work with breast cancer, where you're focused and how you came to focus on this. And then we will get to the open Q&A. So let's start with Dr. Edith Mitchell. Dr. Mitchell?
Thank you so much, Athena. It's so good to be a part of this panel. I've worked with Karen for many years, and what I do in terms of breast cancer, I do treat patients with breast cancer, and particularly those who are at high risk. So more frequently in our practice, the high risk patients are referred to me for treatment. But as a part of my work with Thomas Jefferson University and the Sidney Kimmel Cancer Center, where I am the founder of the Center to Eliminate Cancer Disparities, we are working with various aspects of cancer care. Many people think that it is just related to treatment, but there are characteristics of communities that might increase the risk of breast cancer to some individuals. But I am particularly interested in access to care. In many communities, there has been redlining over years. And what that has allowed is that our communities are separated by socioeconomic factors, so segregated by lack of food institutions, supermarkets. We can tell our patients to eat healthy and take care of themselves, but there are no supermarkets where they can obtain fresh fruits and vegetables. There's also the lack of healthcare institutions. So to travel to a center where they can get good care, many individuals have to take 3 different methods of public transportation to get there. They must miss work, and therefore that's missing economic factors. So it's looking at the communities and what we as healthcare institutions can do to affect the communities. So what we have engaged Jefferson Health Systems is to place appropriate medical care institutions into communities so that there is quick and adequate access to care. We have a mobile mammogram unit, as well as fixed site mammogram and radiology units in the communities so patients don't have to travel, and that there is adequate insurance or adequate areas of care. Insurance, I work with the insurance companies to know the guidelines and to affect those guidelines into care so that physicians don't have to do the extra phone calls and the predisposed areas in order to get care for the patients. And I've worked with the health policy in our state of Pennsylvania and those neighboring states close to us, so that there is access to care, access to Medicaid for those individuals who are eligible for Medicaid. And I've worked with the National Cancer Institute for many years. National Cancer Institute formed in 1971 with the National Cancer Act that former President Nixon signed. And this is 2021, so it's 50 years of research through the National Cancer Institute, so that we have new research. And the thing for us to do is to make sure that there's access to those research studies, new technology, new therapeutic interventions, so that our Black patients are getting the greatest, the best at the right time.
Absolutely.
No delays in diagnosis and so forth.
Wonderful. That's so important. Early detection, having access to care, everything you mentioned. I'm sure we're going to discuss those in more depth during the panel. Now, Dr. Lisa Newman, would you briefly tell the audience about your work with breast cancer?
Thanks, Athena. And again, Karen, I want to thank you for allowing me to be a part of this program. The power, the talent, the energy, and the beauty of this channel is just phenomenal. I'm so glad to be a part of this. In my capacity as a director of a multidisciplinary breast program for the Weill Cornell Medicine New York Presbyterian Hospital Network, I'm honored to be able to oversee the multidisciplinary breast care delivered in our Tri-Borough network. And we follow the model that Dr. Mitchell described. Patients have to receive that highest quality multidisciplinary breast care in their community. And so our program is situated in Manhattan, in Brooklyn, and in Queens. And we make sure that patients can avail themselves of all of the most important, highest quality aspects of breast cancer care across all specialties, including diagnostics and including clinical trial participation options equally across all of those sites in the different boroughs. As we have discussed several times in this conference throughout, it is not only important to make sure that we address equity and access to multidisciplinary breast care, that is a huge priority, but we do also need to address the research issues. And in my capacity as a breast cancer researcher, I do have the honor of also running an international breast cancer program where we partner with different cancer treating facilities across various regions of Africa to study the genetics of African ancestry and how our genetics and African heritage does also play a role in predisposing us for certain types of breast cancer, such as triple negative breast cancer.
Wonderful. Thank you, Dr. Newman. We all know how important research is going to be to bringing down these disparities or closing these gaps. Now, Dr. Kimberly Jeffries Leonard is going to talk about how the Links Incorporated has become involved in the fight against breast cancer. Dr.
Thank
Jeffries
you.
Leonard?
Thank you so much, Athena. I want to thank Karen Jackson for allowing me to be a part of this phenomenal panel. And I want to thank you too, because I know that, Athena, the work that you do is very important. And I know that these are labors of love. I'm pleased to be able to talk about the Links Incorporated and all that we're doing as it relates to breast cancer. And I want to give a shout out to all of the Links who are on this town hall. This is a very critical issue. Breast cancer work is not new to the Links Incorporated. In fact, we've been working in the area of breast cancer for many, many, many years. Under Dr. Gwendolyn B. Lee, we started a partnership with Susan B. Komen for the Cure. We have evolved that work. We now are partnering with a number of organizations because partnerships are critical, including the Sisters Network and the organizations that are reflected here today. We have a very dynamic partnership with the American Cancer Society on a lot of different levels. We've got ambassadors that we're working to put health equity ambassadors in every chapter and in every area. We've heard from our experts and also from the panelists who've just spoken that equity and disparities really are the critical issues. And so for the Links Incorporated, our goal is not only to bring this education to our communities, but we have to make sure that we're bringing it to ourselves and keeping this in front of us. We can know in our heads the things that we need to do, but taking that knowledge and putting it into action is the other thing. And just as you've heard on the town hall, early detection, access to care, and even the phenomenal task force work that Karen just talked about in terms of mammograms versus sonograms. Those are all really important when you talk about moving the needles. So what we are trying to do is not only through our Health Equity Ambassadors program, train our members to be able to go out into the community and talk about and educate on the things that you need to be looking for and the things that we need to be doing for prevention in terms of getting our tests on time. But we are doing our sister check. Links in pink. On Wednesday, we wear pink. We love our green and white, but I'm happy to sit up here in pink today in honor of October being Breast Cancer Month. And I will say, it was a Link sister, Linda Brown Kidd, who said to me many years ago, "Are you getting your mammograms?" I was not. And it wasn't until she kind of called me out that I started really focusing on ensuring that every October I went and made sure I got a mammogram and a sonogram. And so those are the things that the Sister Check program does for the Links Incorporated. We check in with 5 Link sisters. Are you doing the things that you need to do to ensure that we are taking care of our health? Because if we don't take care of our health, then we're not going to be here to take care of everybody else that we need to take care of, including our communities. So we are excited about the programming that we are doing. We are excited about being able to ensure that our community understands. And we're also excited about having advocacy and policy work. I know that the Congresswoman Sheila Jackson Lee will be here at some point during this town hall, but she is introducing legislation that is a part of our legislative agenda. And so when we look at all of the comprehensive things that have to go into a program to ensure that we're eradicating breast cancer, it's education, it's knowledge, it's action, it's reducing these disparities, and it's the advocacy agenda that we are pleased to be behind. So I'm excited. It ties into the work that we've been doing, the work that we are doing now, and the work that we have to continue to do in order to make sure that we're moving the needle and eradicating breast cancer, especially in our Black community, because that's where it's ravaging the most.
Wonderful. Thank you, Dr. Jeffries Leonard. And I like what you said about you got called out. Maybe we all need to be calling out our sisters and really any women in our lives to make sure that they're doing what they're supposed to be doing. So that one made a difference for you. We can make a difference for others. Okay, we're also going to hear from Dr. Aronica Williams about your work, your organization's work, Sigma Gamma Rho, with the issue of breast cancer in Black women. Dr. Williams?
Well, Greetings and good morning to everyone on the call. I am elated to be here to represent Sigma Gamma Rho Sorority Incorporated. In the absence of our international Grand Basilisk, Rashida Liberty, I bring you greetings regarding our Women's Wellness Initiative and also our partnership with Sisters Network. So just to begin, our Women's Wellness Initiative of Sigma Gamma Rho Sorority Incorporated is a consolidated effort that allows our sisters and our chapters to focus on health issues that impact women, but specifically women of color. And even when we drill that down just a little bit further, African American women. And so this initiative was developed after our sorority's participation in the United Nations March of Dimes Prematurity Awareness Month and panel. However, it actually evolved into so much more. And so some of the initiatives include, but are definitely not limited to, breast cancer awareness, and that's of course why we're here today, intermittent domestic violence, heart health and diabetes health, and mental health. So we know that all of those different things are important. Our goal is to encourage women to maintain a healthy lifestyle and minimize health risks. And again, with that sister check-in that our sister from the links just talked about, again, checking on each other, reminding each other, and then making sure we're doing those follow-ups. Empowering women to make informed decisions about their physical, their mental, and their emotional health. And so we often host a slew of webinars to make sure that our sisters and our communities are, of course, informed, but also they are then empowered to make informed decisions based on the information that they've received. And lastly, the main tenet of our Women's Wellness Initiative is to ensure that there is a representative number of African American women in health studies. Many times, as you can imagine, we don't see ourselves represented in studies, and therefore we may be hesitant to try new interventions or to go down a specific path with respect to treatment. So we want to make sure that we are ensuring that there's a representative number of African American women in health studies, because we know that that is going to be pivotal to the success and the improvement of our health as a whole. As we transition to our partnership with the Sisters Network, and I would be remiss if I did not thank Ms. Karen Jackson for just allowing this opportunity for us to speak on that partnership. Our partnership began a little over a year ago in October of 2020. Since then, we have donated $22,000 that we donated this past April to mammogram coverage for women in underrepresented categories and underserved categories, to make sure that they have access really to that prevention into those screening studies. And so that is pivotal. Again, as we continue in this partnership, next Friday, so on a Friday night, our sisters are going to be gathering for a party in pink, where we're going to actually be raising funds to commit to another 100 free mammograms for individuals who may not be able to receive or have funding otherwise. And so we understand that there's going to be partnerships that really exude from our partnership with Sisters Network. And we understand that there's power in partnerships, and the collective work that everyone is doing on this panel, it makes the load just a little bit lighter. And so if we have so many hands on deck from all of the women and all of the women leaders who are here for this very important cause, then guess what? We're putting out that message. It's coming with strength. It's coming with power. And the load is just a little bit lighter on all of our shoulders for this very, very heavy lift. In my professional life, as mentioned, I serve as the Chief Medical Officer at a community health center. So as an FQHC, a federally qualified health center, our aim is to ensure that every patient, regardless of their ability to pay, has access to quality, affordable healthcare. And so again, as our sisters on this panel have mentioned, food insecurities, mammogram access, even access to a primary care provider, we take those things for granted sometimes, but we have to make sure that our sisters, regardless of where they fall on the economic spectrum, have that same opportunity. And so once again, I am elated to be here to share with you, to represent our International Grand Basilisks in the effort that we have engaged with Karen Jackson and the Sisters Network, because this work is powerful and it is so needed. So thank you for this opportunity. The work continues and the efforts are tireless.
Wonderful. Thank you, Dr. Williams. All of you are doing amazing work. This panel, this Q&A is going to be focused on ways we can work together collectively to have a stronger voice and advocate for change. I've seen a lot of questions popping up in the Q&A, so keep those coming. We want to try to get to as many of them as we can. And so let's just dive in. This is a question that really could go to anyone. I'm hoping that if we have one or two people answer each question, we can get to more of them. So I'll start out with this one. Why is it important to work together? Why must this be a collective effort? This effort to reduce the gap and bring down disparities and save more Black women's lives. I don't know if Karen Jackson wants to launch that part of the discussion, or Dr. Newman.
Well, I can turn it over to our new people because we've had the discussion earlier, but if no one else, I'll jump in.
Well, I can jump in on that.
Sure.
I think it is so much more powerful when we work together. When we're working together, not only do we have the voices of ourselves and our organizations, but we have the voices of other organizations. And when you talk about galvanizing the collective power of Black women and Black women's organizations, we're talking about millions and millions and millions of women. And so when we talk about bringing together millions of women, not only can we make a difference in how we address health and making sure that we're getting messages out and information out to our communities and to ourselves, but this is the power behind the policies that are going to move to allow us to have access, to have to reduce disparities, to ensure that clinical trials are set up so that we can get women of African descent. So I think that when you talk about partnerships and you talk about engaging all of us with one voice, the opportunities are endless.
Wonderful. And Dr. Williams?
I think that, as we said before, the power behind just this panel, right? We're a small microcosm of all of the great work that's going on. But if we have the same message, then hopefully we are dispelling myths. Hopefully we are limiting confusion. And then hopefully the disproportionate aspect of mortality and incidence and morbidity that we see with African-American women is going to go down, because when they tune in with Sigma Gamma Rho, when they tune in to the Sisters Network, when they tune in to the links, they're hearing the same message. And so that's the power in doing this collective work, because when we're all on the same page, hopefully somewhere in there, wherever that sister tunes in, she's going to get the same message. And it may look different in different colors, but the same message is going forth. And again, we're reaching everybody with the same message, with the same power, and with that same tone.
That's
Amen,
exactly right.
sister. Amen.
And we know so much the importance of repetition. I mean, it's a part of advertising, it's a part of politics. Having that same message and repeating that same message across the board is so important. And Karen Jackson, sorry, go ahead.
Athena,
Yes, Dr.
I'd
Mitchell.
like to add to that.
Please do.
Yes, we have all of our organizations participating, but we also have National Cancer Institute clinical trials available throughout the country. There are over 1,100 sites that have these clinical trials where we can get the information, we can get the genetic testing done, as well as the genomic profiling, which is also very important. And many people think that when we say genetics, we're talking about the same thing, but genetics and genomics are different. And we've got to make sure that we bring the practitioners into our point of view so that patients not only have the information that they receive from us, but also, I will say us, as I am a member of the National Cancer Institute's programs, but we need to get our people into the right screening procedures, the right diagnostic procedures, and the right treatment and diagnostic procedures. So we've got to do the full, I've called it Edith's 360. So we got to do the 360. And this group can certainly take that message.
You know, I
Absolutely.
want to say to Dr. Mitchell's point, clinical trials are so important because what is happening is if we're not represented in clinical trials, then decisions and protocols are made based on people who don't look like us, people who are not made up like us. And so when Dr. Mitchell talks about the fact that there are so many NCI clinical trials, it is up to us to get the message out, just like we had to do with we're doing with the coronavirus vaccination. This is not Tuskegee. We have to keep saying that over and over and over. I did my postdoctoral fellowship at the Howard University Cancer Center. And in that postdoc, I realized there's so much hesitation from our people that we have to make sure that we are helping to alleviate that hesitation and providing the information. On the flip side, I know, and we've done a lot of changing. We have to also put the message out that clinical trials have to be accessible to our people. Can't be between 9 and 3, 10 and 5, because we work. We have to have childcare. So as Dr. Mitchell said, it is a 360. We have to make sure that we're bringing people in from our side, and that those who are putting together clinical trials are ensuring that they're accessible and meeting the needs so that we can come in and be a part of those trials.
And Athena, I think you're right with I'm sorry, sister. We all soars today and sisters. But Dr. Leonard, and you took the words right out of my mouth. I think one of the things we understand some of the, let's say, collective history. I won't call it baggage, but collective history that goes into every decision that individuals of color and African-American individuals bring when they come into their visit with their provider. And if we're not addressing those things, we're going to lose people. And so when I'm with my patients, I present information, I call it bite-sized morsels. So like with Edith's 360, I was like, yes, but bite-sized morsels, because you can't give people too much that then they can digest, right? But beyond that, we have to understand where people are coming from to get them where they are. And so Dr. Leonard mentioned, absolutely, this is not Tuskegee, but we have to also understand that some people may be stuck there. So we have to, through our education, through our outreach, through our webinars, and through those touch points, we actually have to get them beyond Tuskegee to the present so that we can ultimately get them what they need. Sometimes people don't know what they need because they're stuck on getting information from, oh, I read it on Facebook, or, oh, my sister told me, or this or that. And sometimes I get a little bit facetious in some of my visits because I said, well, are they in the medical field? You know, because again, I want people to understand, like, hey, get your information from trusted sources, but also informed sources. But I think there's a certain level of patience that we have to exhibit. And I think everyone on this panel is in the fight of that, you know, exhibiting that patience to get people where they are, from where they are to where we need them to be, because you're absolutely right, Dr. Mitchell. We have to make sure that people know about these clinical trials and pair that with what Dr. Leonard said, bring it to the FQHCs. Maybe sometimes we got to go to where the people are to get them where, you know, to get them to that next level. But if we're not thinking outside of the box, which everyone on this webinar is doing, we're not thinking out of the box, we're going to continue to miss that end population, that target population that we're trying to reach, because there's so many different competing complexities that people of color and African Americans have just to get to the doctor's office. They have to pay somebody for a ride. That same $20 is also for the copay. Then you wonder why they can't afford the medicine. And then someone said before, you know, we tell them to eat healthy, but how do they get there? So there's so much that goes into that, but that patience is what is needed to take us to that next level.
Wonderful. Well, thank you, Dr. Williams. I want to make sure we get back to Karen Jackson. This whole event is centered around the announcement of this task force, and we're actually getting some questions about the task force. And so here it is. So this task force seems like a great opportunity to be a vehicle to advocate for policy in a collective way. Vanessa Ethels writes, most of us are involved in organizations within our communities, whether it's sororities, churches, civic groups, et cetera. What tangible things can we do in our local communities to support the efforts Mrs. Jackson announced? And then one more thing, someone else is asking if you could put up on the screen again that slide, if you have it readily available, that sort of summarizes that new initiative as for part of the time Mrs. Jackson answers this question. So go ahead, Mrs. Jackson.
Well, the new initiative, as we are all talking about, I want to mention that Sisters Network's National Creed that was done in 1995, our National Creed states, in unity there is strength, in strength there is power, in power there is change. So you can see the transition from the beginning to now. It has always been strength, power, change. We are at the point of change. Thank you all for being here to bring the change to the community collectively. This is exactly what we need. Everyone has the issue. We pull it all together and make it happen.
Wonderful. All right, let's see. There are several more viewer questions. One says they never hear about clinical trials. I know this has been addressed at some point in the conversation, but can one of you, perhaps Dr. Mitchell or Dr. Newman, one of the doctors, weigh in on how to help remind people once again how they can find out information about clinical trials?
Certainly. The National Cancer Institute on its website has the information on clinical trials related to both diagnosis of breast cancer. It's called the TMIST, it's TMIST trial, and it's ongoing to try and find out the best way to use mammography for defining risk individuals. There are also other clinical trials related to types of breast cancer. How do you obtain genomic testing, and what does genomic testing mean? And then there is genetic testing for family members. And when we think about family members with breast cancer, we always talk about family members with breast cancer, but there are other cancers that are equally as important. For example, ovarian cancer or pancreatic cancer, where there are genomic mechanisms to determine risk. So everyone needs to get a risk assessment that covers all aspects of breast cancer care. And also remember that men get breast cancer, and Black men have the highest incidence of breast cancer of any male population in the United States. And another area, Athena, we've got to deal with our health policy individuals, members of Congress, members of our state legislatures, to make sure we got the right laws in place that we can take advantage of the various aspects of breast cancer care. So get with your legislators, make sure they know who you are and make sure they know what your message is.
Thank you, Dr. Mitchell. I want to add that Dr. Tanya Mosley, who led one of the other sessions, just added to the chat a link about breast cancer clinical trials and a link about Black men and breast cancer. So if you're following along there, you can go in and copy those links. And I assume, Dr. Mitchell and others, that if someone else asked if there are DCIS, ductal carcinoma in situ studies or trials for survivors in New York City, my guess is that these databases would have that kind of information by state, by city, by location, that sort of thing, correct? About whether there's a trial in a specific city.
So many of the trials are national trials, and they are available in many cities. And
Wonderful.
The NCI has over 1,100 sites for clinical trials in this country.
Thank you. I want to drill down for a few minutes on screening, because this is a large part of this focus, people making sure they detect the cancer as early as possible. As Black women continue to be diagnosed with breast cancer at a younger age, do you believe it's time to advocate that the current breast health screening guidelines be adjusted. And we've already heard some saying, yes, we support this and this is part of the initiative, but I want to hear more from the doctors about the idea of a baseline mammogram, and also about, is there any harm in getting a mammogram, maybe one mammogram in your mid-30s, just to get that baseline? What's sort of the downsides to early testing? Perhaps we can hear from Dr. Newman about that, or go ahead.
Thanks, Athena. If I could backpedal a little bit, though, I did want to make a comment about the clinical trials discussion, just very briefly, to remind everyone in the audience that there are a lot of different clinical research types, and not all of them involve treatment. Some clinical research opportunities involve weight control, involve prevention, involve screening, has been discussed. Some clinical trials and clinical research opportunities involve just sharing your health information so that we can learn more about risk factors for breast cancer, which is so important, especially in the Black African American community. Now, with regard to screening, there are definitely risks associated with doing mammograms at an exceptionally young age. And so we really don't like to offer mammography as a routine yearly screening test for women that are younger than the age of 25 to 30. But there are other ways to screen these very young women, such as breast MRI or whole breast ultrasound. And so for women in these young ages who might be at higher risk for getting breast cancer at young ages because of hereditary predisposition, there are alternatives to mammograms that they can consider. But mammograms, if they are initiated at too young an age and performed yearly, that can be associated with radiation complications. We do have to be thoughtful about how often we screen with mammography and how young we start. I do, however, believe that we need to be mindful of the younger breast cancer age distribution in African American women. And we have a long way to go to optimize on the benefits of routine screening mammography beginning at age 40 and done on a yearly basis. We're not seeing mammograms being performed in 100% of African American women starting at age 40. We have a long way to maximize on the benefits of that routine screening recommendation starting at age 40. And again, we do have to remember that mammograms are not perfect. So new symptoms in the breast, like a lump, bloody nipple discharge, change in the skin of the breast, should prompt medical attention, even if you had a normal mammogram a week earlier.
Right. I wanted just a quick reminder as we carry on with this discussion, we have about 20 minutes to go. And I want to remind everyone who's watching to take the survey at the end of the town hall, just to provide your input about what you heard today. We have a lot of questions that still remain that are pretty medical specific, but I want to hear again from Dr. Jeffries Leonard and Dr. Williams about the programs your organizations are working on. One person asked specifically, are all LINCS chapters working on this national initiative? So just, I want you to talk, each of you to talk a little bit briefly about the importance of early detection and what your organizations are doing. I realize you touched on this earlier, but I want to have you have your say again.
So I am happy to start. Our LINCS chapters are working on cancer-related issues. In October, all of our chapters are focusing on issues around breast cancer. We know that, as our physician said, that there are other cancers that we also be mindful of, and they are very important to screen for also. But in October, our chapters are working to ensure that our members within the organization are doing the Sisters program, where we are, connecting with each of ourselves to ensure that we are doing the things that we need to do. But we also are working in the community. We have, as a partnership with the American Cancer Society, what we call the HEAL program, Health Equity Ambassador Links. And this is a program where we are training. And if any link is on this call and wants to be trained, let us know. We can do that. And that we're certified as health equity ambassadors to be able to ensure that we have the tools that we need to go out into the communities to provide information that, as our sister said, basic information, because too much, the goal is really just to get you to start looking, what are the symptoms? How do we screen? Where do we go? How do we do preventive things in terms of what we eat if you're predisposed or you have some other health issue that may put you at risk? What kinds of things can you do from a preventive standpoint? And so once you are able to start that conversation and put those things on the table through the HEAL program, it allows us to be able to encourage our members of the community to be able to go and get checked and do some of these tests, in addition to getting information and resources on financial support, other kinds of things that can help cover, because we know every insurance doesn't cover everything, even though we have to work to ensure that our insurances are covering the basic things, because prevention is treatment. If we can prevent something, then we don't have to go down other roads. And that's really what we want to be able to try to do. So our chapters are working towards that. That is really very important to us because the Health Equity Ambassador Links program, we feel, can really move the needle.
Wonderful, thank you. And Dr. Williams, you want to briefly comment on this? There's several more questions I hope to get to, maybe in kind of a lightning round, but I'd love to hear more about, just a little bit more about what Sigma Gamma Rho is doing.
Absolutely. So as previously mentioned, as a part of our Women's Wellness Initiative, breast cancer awareness is one of the main tenets, health tenets, as a part of that Women's Wellness Initiative. And so this is a multifaceted approach with international directives from our international leadership to support different initiatives, fundraising campaigns to support our partnerships like the one that we're talking about today with Sisters Network. And then ultimately throughout the year, so of course in October, where we hit it hard with webinars and educational initiatives and things of that nature, but throughout the year, chapters are still encouraged to have outreach efforts, and their creativity is then utilized with respect to local partnerships and how to carry those things out. And so many of our chapters outside of the month of October will partner with different organizations as a part of the National Panhellenic Council. That is, of course, all of the fraternities and sororities. And so we partner with them throughout the year for various breast cancer initiatives. And then we also partner with local health departments, local FQHCs, and local larger health entities to have mammogram drives outside of the month of October to continue the efforts throughout the year. And so again, we hit it hard in October, and then throughout the year, there are creative aspects in programming that is up to the chapter's discretion of how to walk those things out. So it is a multifaceted and tiered approach to make sure that we're continuing to get the word out all year long.
Athena, I want to add to this that because we are a national breast cancer organization, that is our total focus. And that's why we love to have the input and the support of the other organizations that cover many multitude of cancers and health issues. But like my beautiful Link sister, she mentioned about the HEAL program, and Sisters Network is already involved with the HEAL program, and it will launch this month. And it is an exceptional program, and it's a quality program. So we will be involved in using that, just like with Sigma Gamma Rho with the financial help. That has increased our mammography screening program. So you can see it's a back and forth kind of initiative for all of us to work together. So Wonderful. We are doing that now. And anyone is interested in being a part of the task force, we will be sending out information via the participant list. But if you have friends or neighbors who might be interested that are not on the list, they just have to email Sisters Network and request the information for future things.
And what is that email, Mrs. Jackson?
You can reach infonet@sistersnetworkinc.org.
Infonet@sistersnetworkinc.org. Wonderful. We only have about 10 more minutes, so I want to quickly run through some of these other questions that are kind of housekeeping questions. Several people have asked if they'll have access to these sessions today. people who were taking notes but didn't write fast enough, because there's been so much information that's useful shared today. How will people be able to access this after this event is over, Ms. Jackson?
We are going to send out the link to everyone. You can access it on our website. We will be sending it out through our constant contact. We will be, just like you received the invitation to join today, you will receive the information to access this webinar.
Wonderful. And I understand that will remain live on that platform for about 2 months, 60 days.
Yes.
Wonderful. And the person who's asking about the requirements to start a Sisters Network chapter can probably get that information
By
emailing.
contacting us.
Yes, InfoNet.
Yes.
Another question I have here from, let's see, someone else was asking, can they donate to sponsor a mammogram for those in financial need? It sounds like some of the organizations represented here help with that, Sisters Network included, as well as Sigma Gamma Rho. Is that correct?
That's correct.
All right. And same
So
thing. with-
Athena, may
Yeah.
I say a word about that? Yes, we have opportunities, Alpha Kappa Alpha, the links, all of us are doing that. However, there is a function we need to get with our legislators and health policy aspects for each state. First of all, the Center for Disease Control has a program that is available to every state for the breast and cervical cancer
Yes.
project, and it gives mammograms and pap smears and other diagnostic tests for breast and cervical cancer. We need to take advantage of that. And then the states that have demonstrated through the Affordable Care Act, Medicaid expansion, there are data from those states showing that there is a decrease in disparities by making tests available. So we need to make sure that our legislators get those programs into every state and make sure they're available to the appropriate people. That's a way of making sure that there's access to care.
Well, unfortunately, Dr. Mitchell, there's where systematic injustices pops in.
Yep.
And affects our community from accessing what is available, because these programs are extensive, wonderful programs, but we aren't able to access at all times. And Sisters promotes this, we believe in this, but it does not always work. So we have to have an underlying support system that will help you get what you need in spite of the wonderful government projects we have.
Great. Well, I think we have time for 2 more questions, and one is going to be a treatment question. Triple negative breast cancer, we know, impacts Black women more. They're twice as likely to get it. Someone, a questioner writes, please speak to the importance of cutting edge immunotherapy treatments and the access to our sisters with triple negative breast cancer. Why wasn't it an option 2 or 3 years ago? But also, what good things is immunotherapy treatment doing now for Black women with breast cancer? I believe Dr. Newman will have something to say on this. Dr. Newman?
So the immunotherapy and novel approaches to managing triple negative breast cancer are definitely very, very exciting, but it is also a painful reality that these advances are costly and they are not necessarily available broadly. It's already been mentioned that we need to support our safety net hospitals much more aggressively, especially in the post-COVID era, where our safety net hospitals have been disproportionately devastated by the COVID recession. And Edith has been mentioning the Affordable Care Act and expanded Medicaid states critical. Medicaid is especially important in supporting now because the unemployment rates are that much higher in African American, Hispanic, Latinx communities in the context of the COVID recession. And these difficulties with employment, higher unemployment rates mean more need for Medicaid, expanded Medicaid. And we need to make sure that these advances in treatments such as immunotherapy are available regardless of payer status. It is exciting. I love the advances that are being made, but they are not widely available on a broad basis. I did also want to make a plug. I'm so proud of what Sisters is doing in terms of bringing all of these resources together with this task force and this new initiative. I want to also make a plea that the task force address a couple of other things. Making sure that we get more of the younger generation to pursue careers in healthcare and careers in sciences. We got to bring all of that talent of the younger generation together as we continue to fight this battle in the future, and also in addressing the digital divide. You know, we think of the digital divide as being something between rural and urban communities, but it's so much more than that, especially today. We see horrible disparities in terms of access to high-speed broadband internet, even within cities between Black neighborhoods and white neighborhoods. And that has to be corrected. Now in the post-COVID era, we are that much more reliant on the internet for education, for employment, and for healthcare. So the digital divide needs to be addressed. Access to the internet should be like access to running water. So please, I hope the task force will address some of those issues as well.
Well, we'll make sure we check back with you, and you can be very much involved with the task force to keep us in line with these issues, because we want to cover everything that is important to our community to move forward. So yes, that would be something that we can consider to add to the list.
And
Thank
Mrs.
you.
Jackson, thank you all. I know we're going to close with you, Mrs. Jackson, but I also have one more question that we've kind of talked around, but I don't think we've addressed it directly in the discussion portion, which is, you know, the importance of programs and resources for Black women that can help them maintain their emotional and mental health after treatment, help them get back to themselves, their independence, their state of mind, improving that. And you talk about the Sisters Network as a survivorship organization. Combined with that question is another one where someone's asking whether groups have mentors that can help someone who's diagnosed with breast cancer navigate and manage their treatment. So I think that's a perfect question for you to end on, Mrs. Jackson. So go ahead.
Well, I'm happy to talk about that, because the sisterhood, we understand as an organization, is most important to your journey. And we try to pair newly diagnosed women with another member who's already been through it, has done well, knows the system that can help them be the next survivor. And we let women know that when you are initially diagnosed, you are already a survivor. So many women call and say, I want to be a survivor, and they've already been diagnosed. They think it's something you join. So they already joined, they just didn't know.
Yeah.
But it's interesting because we know that when you have someone that's your buddy, we don't call it a mentor, it's a buddy that you can call at any time to help you pass the challenges that you're facing. And if they don't have the answer, they can contact me. They know who to contact to help get that answer. Sometimes we call Dr. Newman or Dr. Mitchell or some of the other doctors on our medical advisory to assist us in things that we want to make sure that we're giving the right advice. We don't just give advice, we make sure that it's coming from statistics and facts.
Right.
But the biggest thing is the support to know that someone cares about your survival. So because of the pandemic, we are not meeting in person. Those hugs and that hands-on is missing within our organization. So the webinars that we do 2 or 3 times a month, the phone calls, that is helping us stay connected with our community. It's very important for women to call, to ask for the help, because it is available.
Wonderful. Thank you, Mrs. Jackson. And I want to hear it from each of you, just very brief closing remarks, maybe like the one takeaway you want the audience to take away from this conversation. Something brief to wrap us up, and then we'll wrap up. Go ahead, Dr. Mitchell.
Oh, thank you so much, Athena. I think I've said a lot, but for individuals who are undergoing screening, we need to continue our screening. It has been down since the COVID pandemic, but let's get our screening back together. Let's get involved with clinical trials so that we have the information that we need in terms of therapeutic intervention. And for the question about immunotherapy, immunotherapy is there, but it does require some genomic testing, and we match the alteration found with the therapeutic intervention. So getting into clinical trials, very important. And think about breast cancer prevention as well as early diagnosis. Thank you very much. Thank you, Karen, for organizing Sisters Network and for organizing this great panel today. And thanks to all the other panelists. It's my privilege to be a part.
Wonderful. Thank you, Dr. Mitchell. So screening levels, clinical trials and prevention. Dr. Williams, final thoughts?
Absolutely. So my takeaways and last words to impart really are twofold. For the attendees, I'll start there. I implore you to make sure that you have a primary care provider. Stay informed with knowledgeable and trusted medical sources, and pay attention to your body. The changes that your body may be going through, but also what you're putting in your body. I know we didn't do a lot of talk on diet. That's a whole nother conversation. But really, when there's information going on like this, make sure you're tapping in to make sure you understand those pivotal takeaways. For my sisters on this webinar, again, let's continue the work. Let's continue the strong work that we're doing. Again, finding new ways to develop and strengthen our partnerships, because we know that this is heavy work, but is much so needed work in order to move the needle with respect to the impact on African-American women. Again, I definitely thank everyone, especially Mrs. Jackson, for this opportunity to represent Sigma Gamma Rho in the absence of our international president, Rashida Liberty. It is our pleasure to continue to do the work that we are uniquely called to do and paired with you in this fight against breast cancer.
Wonderful. Thank you, Dr. Williams. Dr. Newman.
Thanks. Well, I definitely want to echo what's already been said in terms of closing the importance of screening, early detection, breast health awareness, know your body, know your family history, get your risk evaluated. We didn't get a chance to say much about research issues related to the genetics of breast cancer and African heritage, but I do want to encourage everybody out there to explore any opportunities that they might have. You can certainly reach out to me and my team regarding looking at the genetics of African ancestry and how it impacts our risk. We are learning some very powerful things regarding breast cancer and African heritage. And we have some fabulous sisters on the continent of Africa that we need to be partnering with. Across the globe, we can work together.
Wonderful. Thank you, Dr. Newman. And Dr. Jeffries Leonard.
Thank you so much, Athena. First, I want to thank you for your skillful moderation of this phenomenal panel. I want to thank Karen Jackson for not only what she's doing through Sisters Network, but also being a part of our cancer team on the Links Incorporated and serving in my administration. I am forever grateful for that. And I want to, and I hope you'll let us be a part of the task force. It's so important in what you're doing. I want to thank the members on this panel for their really critical information. And as Dr. Williams said, we are stronger when we are together, and we have to be together. I want to thank all the links who have come, because each of our chapters are really what is moving this message. And so on Wednesdays, we wear pink, but every day we are working to move the needle by ensuring that our members in our community get screened, have the information they need about prevention and treatment, and really working to advocate for those things that are going to, those policies that are going to be helpful to our communities, not a hindrance. And so I just say, there's much to do. Keep doing it, because even though we've come a mighty long way, we got a mighty long way to go. Thank you.
Thank you, Dr. Jeffries Leonard. Thank you to all of the speakers. Thank you to everyone who tuned in and who asked questions. Coming up next, please hear from Karen E. Jackson. She's going to be closing out today's town hall with some final thoughts. And please remember, you can still check out the virtual exhibit areas and download items for your digital swag bags. Thanks, and we'll be watching Karen Jackson very shortly.